Hello students, today we will discuss about the two very important muscles of pectoral region. These are pectoralis major muscle and pectoralis minor muscle. Now you know that this anterior chest wall, or you can say the anterior area of the chest, which is known as pectoral region, is mainly consists of a very large broad muscle, and that is the pectoralis major. So let us see about this muscle. So this pectoralis major is the largest muscle of the pectoral region, and it is a thick, bulky, fan shaped muscle which situated on the anterior chest wall. So when you will see this muscle in the dissection, you will find that it is a very broad muscle and it is a fan shaped muscle. What does it mean? That it is broader at one end and it is narrower at other end. So the broader part is its origin area, and this narrow part is the insertion area. That is why it is known as fan shaped muscle. The second thing is that it lies deep to the breast. Now when you will see the breast in case of the female, you know that breast is situated in the superficial layer. Now you know the layers of the wall, you have the skin. Below the skin you will have the superficial fascia, then you will have deep fascia, and then we will have the muscle. Now in the case of the mammary gland develops in this second layer, that is the superficial fascia. So this is your pectoralis major muscle, this is your mammary gland, here is the skin, and this is your deep fascia. So here in this diagram you can see that this is the pectoralis major muscle which is forming the bed of breast. The another important thing is that it is having a broad origin and narrow insertion, that is why it is fan shaped muscle. It is going to form the anterior wall of axilla. Now when you will see the anterior wall of axilla, you can appreciate that this is the muscle which is your pectoralis major. Now when you will see this axilla from the posterior side, you can see that posteriorly you are having these two muscles. This is the teres major muscle, and below you will have the latissimus dorsi. Now when you will cut this posterior wall, I have removed these muscles of the posterior wall of the axilla, then I can see the contents of axilla, that means the neurovascular bundle which is axillary artery, vein and the branches of brachial plexus, and anterior to that you can see this muscle which is known as pectoralis major. So when you are talking about the axilla, you are having this anterior wall of the axilla, you are having the posterior wall of the axilla. This anterior wall of axilla is formed by the pectoralis major muscle, and the posterior wall of the axilla is formed by the teres major and latissimus dorsi. So in these two diagrams you can compare the positioning of the two muscles. This is both are the posterior view. These both you are seeing from the back, but here you can see the layer of muscle, and these muscles are the posterior axillary wall, and that is your anteriorly placed area which is the pectoralis major muscle. Then this is the last line is very important. The upper border of the deltoid muscle separated from the your pectoralis major by a area is known as deltopectoral triangle. Now see, when you will do the dissection, as soon as you will remove the skin and superficial fascia in this area, you are going to see a very small triangular region. Now this is known as deltopectoral triangle. Now when you will see this triangle is having three different wall. Its base is formed by the clavicle. The medial wall is formed by the upper or lateral border of pectoralis major, and its inner wall is formed by this anterior border of deltoid muscle. Now in this way there is a very small triangle will appear, and this triangle is also known as deltopectoral groove, and in this area when you will do the dissection, you clearly able to appreciate a blue color line, and this blue color line is nothing but it is your cephalic vein. What is that? Cephalic vein. So this cephalic vein you know that it is a superficial vein of upper limb which is running on the lateral border of your upper limb, and it become deep after passing through this deltopectoral groove, and then this vein will pierce the clavipectoral fascia here and opens ultimately in the axillary vein. So, this deltopectoral triangle is consisting your cephalic vein. Then you will have the next thing is origin of pectoralis major muscle. Now, whenever you are talking about the origin, you have to understand that the origin occurs by the two heads of your this muscle. Now, these two heads are known as clavicular head and sternocostal head. Now, this clavicular head, as the name suggests, comes from the medial half of the clavicle. Now, when you will see this whole anterior border of the clavicle, there are two parts of the anterior border, lateral concave and this medial 2/3 convex. Now, this lateral 1/3 concave part give origin to the deltoid muscle. The remaining 2/3 anterior border gives origin to the clavicular fibers of pectoralis major. Now, in this diagram, you can see the whole anterior border of the clavicle, which is having the two muscles here. You can see that this is the deltoid and this is pectoralis major muscle. Now, the fibers, those are coming from the clavicle, are known as clavicular fibers of pectoralis major. The remaining fibers, which are actually not only arising from the sternum, but also going in the lower part, these whole area is known as sternocostal part of the pectoralis major. Now, this sternocostal part is further divided into the four components: area from the manubrium, sternum, costal and aponeurotic fiber. Now, manubrial fibers arises from the anterior surface of the manubrium. The sternal fibers arises from the lateral half of the anterior surface of sternum up to the 6th costal cartilage, that will come here. Then you have the costal fibers which are arising from the costal cartilages which are present here. So, these fibers will arise from the adjacent costal cartilages. And lastly, you are having a muscle here in anterior abdominal wall that is known as external oblique. So, you are having the aponeurotic origin of the external oblique muscle, and the lower fibers overlap that aponeurosis, which are known as aponeurotic fibers. Now, in this diagram, if you want to draw the origin, how to draw? Now, see, this is the anterior border of the clavicle. So, first is the clavicular fibers. So, clavicular fibers comes from the anterior border but medial 2/3 of the clavicle. Now, I have to draw the remaining fibers. So, this half of the anterior surface of manubrium gives origin to the manubrial fibers. This lateral half of the sternum will give the origin to the sternal fibers up to 6th costal cartilage. Now, my dear students, how to count the ribs? For the counting of ribs, you have to first identify the second rib, and we know that second rib attached at manubrio-sternal junction. So, this is the manubrio-sternal junction. So, this has to be the second rib. Now, once you have decided this is the second rib, then this will become 3rd, 4th, 5th and 6th. So, this is the attachment of 6th costal cartilage here. So, the origin of the sternal fibers on the sternum is up to the 6th costal cartilage. So, this is the origin of sternal fibers. Now, the costal fibers. So, costal fibers arises from the adjacent costal cartilages from 2 to 6 costal cartilage. So, this is 2, 3, 4, 5 and 6. So, these are the three bony origin. One is from the clavicle, second is from the manubrium and sternum, third is from 2nd to 6th costal cartilage. The fourth origin is coming from the aponeurosis of external oblique muscle, which will come here. So, in this way, if you will draw the whole muscle origin, this is the origin of your pectoralis major muscle. Clear? Now, we will talk about the insertion. As I already told you, it is a fan shaped muscle. So, the origin is big and it converts laterally, and it is having a small origin as compared to the insertion, as compared to the origin. So, the insertion comes on the humerus. So, when it is approaching the humerus for the insertion, it narrow down and it form a U-shaped bilaminar tendon, and that is going to insert on the lateral lip of bicipital groove. Now, what does it mean, lateral lip of bicipital groove? Now, here you can see the humerus bone. Now, on the humerus, you are going to see the two enlargement. One is bigger, one is smaller. Now, this smaller one is known as lesser tubercle, and this bigger one is known as greater tubercle. Now, in these between two tubercle, you are having a clear cut groove, and this groove is known as bicipital groove or intertubercular sulcus. So, it is between the two tubercle, that is why it is also known as intertubercular sulcus or bicipital groove. Now, if I will cut this bone, if for the practical purpose, if you are going to make a cut here, what you are going to see? You will have such kind of picture. Now, here you can see this is your lesser tubercle, this is your greater tubercle, and here you can see this is the floor of bicipital groove. This is the crest of your lesser tubercle, or you can say this is the medial lip of this bicipital groove. This is known as lateral lip of bicipital groove. So, this is the lateral lip of bicipital groove. So, when you are having the humerus bone, particularly in this area, you have to understand that when you will have the circumference of the bone, you are having two projections. This is known as medial lip, which is here. This is known as lateral lip, which is here, and these are the lips of intertubercular sulcus, and this is known as floor, or you can say the depressed part of the bicipital groove. So, on this lateral lip, today we are concerning with this lateral lip. So, on this lateral lip, you are having the insertion of pectoralis major. So, here you can see the three different color. This dark purple color is the medial lip, this green color area is the lateral lip, and this center portion is the floor of bicipital groove. So, our pectoralis major comes on this green color part, which is known as lateral lip of bicipital groove. Now, the bilaminar tendon, as the name suggests, is having the two, means bilamina or two lamina, anterior lamina and posterior lamina. The anterior lamina is shorter as compared to the posterior lamina, and anterior lamina mainly formed by the fibers comes from clavicle or clavicular fibers, and it also contributed by the uppermost manubrial fibers. The posterior lamina is formed by the remaining sternocostal fibers of pectoralis major muscle. Now, here what is the direction of the fibers? The clavicular as well as the sternocostal. Now, you can see that this is the clavicular fibers and these are the sternocostal fibers. All the fibers are going laterally because they have to approach the humerus here on the lateral lip of intertubercular sulcus. But along with that, you can see the difference in the direction. The fibers are going laterally, but the clavicular fibers are approaching downward direction, and these fibers are approaching in upward direction. So, here you can see that clavicular fibers are going downward and laterally, sternocostal fibers are going upward and laterally. Now, there is one more important thing to understand, that sternocostal fibers twist. The twisting is there, and this twisting is occur only in sternocostal fiber, not in the clavicular fiber. And the twisting occurs around the lower border of the muscle in such a way that the lowest fibers are having higher origin and highest fibers are having lower level insertion. Now what does it mean? Now these are the highest fiber and these are the lowest fibers. Now these highest fibers are inserting here at lowermost part. Why? Because the insertion is not as simple as that, it is actually a U-shape insertion. On the lateral lip, there is a U-shape insertion, and this U-shape insertion is very important to understand that there are two lips on the site of insertion. Now one side, here you can see the posterior view to understand the twisting, that the twisting is in such a way that you can see the posterior view. These are the higher fibers and these are the lower fibers. Now these are the higher fibers, these are the lower fibers. The higher fibers are going lower down and these lower fibers, you can see they are approaching at higher level. Now if you will trace this lower fibers from the posterior side of the muscle, you can realize that this posterior fiber is approaching at highest level. While when you will see the anterior aspect, you can see that this highest fiber or the clavicular fiber inserting at the lower level. So you cannot see both higher and lower fiber insertion in a single view. When you will have the anterior view of the pectoralis major, you can only and only appreciate the insertion of clavicular fibers. Why? Because clavicular fibers does not take part in the twisting. So this insertion is just simply like any muscle. But you cannot appreciate the insertion of lower fibers here, or I should say to these sternocostal fibers, you cannot see the insertion. Why? Because the twisting is occurring here in the lower part of the axilla. And this twisting is visible on the inner side. Now where you can see this fold of the muscle. And this fold or the twisting in such a way that the lower fibers now approaching the higher level. Now you should understand in such a way that suppose if I untwist this muscle, then this fiber should come like here. It is something like this. Then the muscle should insert like a single line muscle. This should be the insertion of the whole muscle fiber. But what the twisting is that this portion has been folded here like this. And because of the folding, this lower fiber, which is the insertion point, is here, and once the folding will occur, now you can see this point will come here. So what will happen? The lower fiber is now inserting at higher level, and on the anterior aspect you can see that higher fibers are inserting at lower level of on the humerus. So this is very important line which has been asked so many times, how to explain the lowest fiber insert at higher level and highest fiber insert at lower level in case of pectoralis major. The only answer is twisting of lower fibers. Anterior fibers of the clavicular head, or you can say the upper fibers of the clavicular head, does not show any kind of twisting. These fibers do their direct course. They show their direct course, and these fibers insert directly on the humerus. But when you will see the posterior aspect of the muscle, then and then you can see the twisting is taking place, which you can appreciate here. And because of this twisting, what is happening, that the folding is there or twisting is there, so the lower fibers now approaching at higher level. Clear? Now we will talk about the nerve supply of the muscle. Now you can see that the pectoralis major supplied by the two nerves, medial and lateral pectoral nerves. And medial and lateral pectoral nerves are the branches of medial and lateral cord. Now in this diagram, you can see that this is showing your brachial plexus. But for seeing these brachial plexus and this small pectoralis minor muscle, you have to remove this pectoralis major. You can see the shadow of pectoralis major, and deep to the pectoralis major, when you will do the dissection, you will find a muscle is pectoralis minor, and you will find the branches of your brachial plexus. So once you will remove the pectoralis major, you have this pectoralis minor muscle. Now there are two things to understand. In dissection, you will find one nerve which is coming out after piercing this pectoralis minor on its anterior surface, and this nerve is medial pectoral nerve. And you will find one nerve is running along the upper border, which is your lateral pectoral nerve. So when you are identifying the nerves in dissection, you have to understand there are two nerves. One nerve is which is piercing the pectoralis minor, and this is your medial pectoral nerve, and one nerve running along the upper border of the pectoralis minor, this is lateral pectoral nerve, and both of these now is going to supply your muscle which lies anterior to this is pectoralis major. So you have this question in exam, write down the muscles which are having dual nerve supply. So one of the example is pectoralis major muscle. Now once you will cut the pectoralis major, as I already told you, you will find the structure deep to the pectoralis major. So what are the structure lies deep to the pectoralis major? Pectoralis minor muscle, subclavius muscle, part of the serratus anterior muscle, then you will have clavipectoral fascia, branches of brachial plexus and axillary artery. Now in this diagram, you can see this is the cut margin of the pectoralis major. Once you will cut the pectoralis major from its insertion, you are able to appreciate it a small triangular muscle, and this triangular muscle is covered inside a fascia which is known as clavipectoral fascia, which extends between the subclavius muscle and upper border of pectoralis minor. Now the subclavius muscle is a muscle which lies below the clavicle and the first costal cartilage. Apart from that, you will find the axillary artery, which is divided into the three parts by the pectoralis minor muscle. You will find the branches of the brachial plexus. All these areas are not visible because it is covered by the pectoralis major. So you have to cut the pectoralis major in the dissection to visualize all these areas. Now in this diagram, you can see that sometimes you are having this question that there is a nerve which is running along the upper border of pectoralis minor. Identify this nerve. Answer is lateral pectoral nerve. Sometimes you have the question on the nerve which is coming on the anterior surface of pectoralis minor. Now this nerve is medial pectoral nerve because this nerve comes on the anterior surface after piercing the pectoralis minor muscle. Now there are two interesting facts about this muscle. First, that the pectoralis major most commonly absent congenital muscle. Now if you will have this question that which of the following muscle is having high probability to absent congenitally, answer is pectoralis major. The second question is, if you want to prominent the pectoralis major muscle, how to do? So there are two ways. One is you hold your upper limb in a prayer position and press both your palm against each other. Now when you will do this kind of the movement, you will realize that your pectoralis major become prominent. Or the second way is that you can make a fist and then you press both the fist against to each other. In both the ways, you will realize that you are able to make your pectoralis major prominent. Then what next is, what are the action of this muscle? Now this muscle is showing three action when it acts as a whole. One is adduction, second is medial rotation, and third is flexion of arm. Now what do you mean by adduction? Now this is your abduction and this is your adduction. When your upper limb is going inside, this is your medial rotation. And what is flexion? Now this is the flexion movement, this is the extension movement. Apart from that, the clavicular fibers flex the arm from an extended position. What does it mean? That when my limb is extended, if I am flexing this extended limb, then the clavicular fibers are bringing it in the flexion position. In the same way, the extension of flexed humerus caused by the lower intercostal fibers. Now, extension of flexed humerus means my limb is flexed and I want to do the extension of this flexed limb. So, there are two different actions. One is that extended limb to bring in the flexion. Second is flexed limb to bring in the extension. So, this extended limb is bringing in the flexion by the contraction of clavicular fiber, and this flexed limb come in the extension by the contraction of sternocostal fibers. Then these lowest sternocostal fibers also causes depression of the shoulder. So, we will see these movements one by one. First is the medial rotation of your upper limb. Now, when you will see the medial rotation, you can see that this limb is rotating inside by the action of whole pectoralis major. So, when the whole muscle is contracting, your limb is rotating medially at shoulder joint. So, this is the first action. Second is the adduction. Adduction means this bringing the upper limb towards the midline, and here you can see that this is your abduction, and once the pectoralis major is contracting, you are bringing the limb in the adduction position. So, it is a very powerful adductor and it brings your upper limb back towards the body. So, this is the second action which is known as adduction. Then the third movement is flexion. So, this flexion is again a very important action of the whole pectoralis major muscle. So, here you can see that this is your neutral position and this is the flexion. So, for the flexion, the whole muscle is contracting and it is lifting the humerus towards anterior and forward direction. So, when you are taking your humerus in anterior and forward direction, it is caused by this muscle which is known as pectoralis major, and the movement is known as flexion of upper limb. So, these are the three major action of the pectoralis major. First is that it causes adduction, second is flexion, and third is medial or internal rotation, and all these three movements are taking place at shoulder joint. Now, the next muscle is pectoralis minor. So, as the name suggests, it is a smaller muscle in the pectoral region. It is thin, flat and triangular. So, you can see this triangle, and this triangular muscle is not visible without cutting your pectoralis major. Now, this muscle lies deep to the pectoralis major and it is enclosed by a clavipectoral fascia. Now, this clavipectoral fascia extends from the subclavius muscle to the pectoralis minor and it encloses both the muscle. Now, what about the origin of this pectoralis minor? Pectoralis minor arises from third, fourth and fifth ribs. Now, here you can see it is not arising from costal cartilage. The origin is on the third, fourth and fifth rib, and all the three slips will join together and they will go towards upward direction. And when you will see the insertion of the muscle, it will insert on scapula. Now, on the scapula there is a projection is known as coracoid process. What is that? Coracoid process. So, this will insert on the superior and medial border of coracoid process. So, here you can see that the muscle is taking origin from the three ribs, not from the costal cartilage. What are the name of the three ribs? Third, fourth and fifth rib. After taking origin, all the three slip will go upward and laterally and they will join to form a small tendon, and this small tendon is going to insert on the projection of scapula, which is known as coracoid process. Now, what are the nerve supply and action? Now, it is again having dual nerve supply by the medial and lateral pectoral nerve. Now, when you will see the action, it draws the scapula forward along with the serratus anterior muscle and help in the punching action. What does it mean? That it is again one of the muscle which is helpful in the punching and pushing, which is known as protraction of the scapula. So when you will see the protraction of the scapula, it is mainly caused by the serratus anterior, but it is also assisted by the pectoralis minor, which pulls the scapula forward. The second thing is it depresses the shoulder. It depresses the shoulder because once the origin will contract the insertion, your scapula will go downward direction, which is known as depression of scapula. And it is a accessory muscle in the forceful inspiration, because at that time it fixes your upper part of your inlet so that you can inhale more and more air. Now here we are talking about the action. Now when you will see the protraction, now what do you mean by protraction? When you are doing such movement or the pushing and punching, the scapula will come forward. So that you can appreciate here that this muscle when contract, it will bring this scapula forward. Now this forward movement basically caused by the serratus anterior, but here it is also assisted by the pectoralis minor, because it is also pulling this scapula anteriorly when the serratus anterior is contracting. So forward pulling is not the main action, it is actually assisting the serratus anterior in forward pulling of scapula. Here if you will see the depression of the scapula, you have to understand this is the elevation, this is the depression. So it is pulling the scapula downward and it is helpful in the depression of scapula when it is elevated. So once you will elevate the scapula, and if you want to depress, it is caused by the contraction of pectoralis minor muscle. So there are two actions of pectoralis minor. One is it assisted the serratus anterior in the forward movement of the scapula or punching and pushing movement, which is known as protraction. And second thing, it pulls the scapula downward and it is helpful in the depression of scapula. So at the end of this class, now we are able to understand the origin of pectoralis major muscle. Second is the most important pattern of the insertion. There is a twisting of the muscle will occur, and when you will see the posterior side of the insertion or the inner part of the muscle, you will realize that there is a folding will occur, which is known as twisting, and because of the folding, the lowest fibers are having highest insertion on the humerus. Apart from that, you know about the action of the pectoralis major and nerve supply. Apart, we have discussed about the pectoralis minor, its origin, insertion, nerve supply and action. So this is all for today's class. Thank you.